Okay, I've decided because I have a lot of dates, and these dates are important. So I'm going to treat this, imagine a puzzle, and I will point out the different years that some creative thinking and proper health care was started regarding nursing. Um, and so I wanted to think of it as a rainbow, because Effie likes rainbows. Should have mentioned her name. Sorry. Anyhow, in 1970 was when I met Effie, along with some other very progressive health people that were brought up to 50 nurse leaders in the state of Alaska. And so since then, we have been good friends. That year, the Nixon administration was very involved in concentrating in the, we had very high mortality. Ooh.
Gotta be close, sorry.
Anyway, Nixon was really on top of this, and he had his administration. At that point in time in the 70s, there was a high rate of mortality and maternal and infant mortality, as well as a huge increase in teen pregnancy, if you remember that era. And that was not only traumatic to the population, but it was very costly for the population, as well as the need for family planning for low-income populations. So hence, at that time in 70, the development of Title X family planning services began. And that was quite an involvement. Then that's the first puzzle. Now, figure out another piece was in, which also continued in 1970. Alaska, Washington, Oregon, and Idaho were under California, Region 9. But because of this new emphasis on this huge program, they developed another region, Region 10, which held these 4 states, because they really were quite different than the previous states in Region 9. And so that is another piece of the puzzle. Then let's see. Also, in 1970, this plan was great, but they hadn't planned on how it would be delivered. And so the biggest issue, UCLA is really, I can't say enough for UCLA. It's so progressive, and it takes on issues for the whole country in many areas. And this was a big area. And so doctors from UCLA went over to China, and they looked at how the rural parts of China were being helped and treated, because they were having issues too, and they needed medical treatment out in the large rural areas. And so they had the barefoot doctors, and they brought that. Yeah, Rose told me a lot about that. And they brought that back to the U.S. and to UCLA, and they used that model. That's the model they used. And it's a perfect model. And that model Alaska had developed a model similar to that for rural native areas where people couldn't come during the especially winter. And so the state public health nurses rode the dog sleds to the villages, and they were in touch by wire. They had standing orders. They were in touch by wire to with the doctors if they had to do minor surgeries or pull teeth or do whatever they had to do that weren't necessarily in their job description. And so they were the model that was developed, and that's why Alaska was chosen to be the state in our Region 10. And so at that time, there were 2 very important people. One was my supervisor, regional supervisor, which was Vivian O'Lee, and she also was a nurse. She was a school nurse and did some very innovative things in school nursing at that point in time. and then a Dr. Axelrod. Some of you may know him, I don't know, but he just retired, and he was a young doctor, and he had an internship, and he had some time and money, I guess he had to pay back, so they selected him, and he was an innovator too, and so was Vivian. And so when I met Effie, I knew I had to introduce her to Vivian because that's where my federal money came from, and I knew I was bringing her up to my staff and to the nurses of Alaska. So, okay, so that's another puzzle. Then, we got them. And the third puzzle piece was 1971. Okay, so now we've got a plan. We've got the doctors organizing a program for advanced care and nursing. And so this is what really started a nurse practitioner. But this was the very first they had, before they could do that, in 1971, they had to have the Nurse Training Act, Federal Training Act, pass the expansion of the role of the nurse to provide these services. So it's a very step-by-step process, but it's something that's lasted and will continue to last through time because it was done properly. So that person was titled the first women's healthcare specialist in the United States. And that was really the beginning of who's going to become your so-called now, today, your advanced nurse practitioner. Okay, so we had 2 wonderful nurses to send, and they completed the program, which I think was to last a year. They completed it in 3 months. They were, and the reason that was is because one of them, well, they both were public health nurses, and one of them had, and they weren't older, they were young nurses, but the one had been in the Peace Corps in Central America, so she had a lot of experience, and the other was a nurse midwife from Kentucky who had worked for a while horseback. I guess they called them horseback midwiferys. So they deliver up in the hills by horseback and help deliver people. And she had run up in Fairbanks, had run a northern area. So she came, and the 2 of them went out. They didn't know how long it would take, but it took them 3 months to learn the material. And then they came back, and they were under a doctor's care because you had to have 100 you had to be okayed for 100 IUD insertions, if you know what an IUD is. But anyway, that's a form of birth control. And that was very popular in those days. And so you don't know how many you're going to get. So when they come back, our local OBGYNs were wonderful. They gave free time to these nurses. And then once they became the newer term, nurse practitioners, they were all hired by doctors. They liked them. Okay, so another piece of the training now, so we've got this going. So in 1974, the nurses went out to train, and that was because the doctors at UCLA had developed a program, and it was a very wonderful program. And let's see. And one thing Effie did, she really was into education, and that's so important, as you've learned from all the previous speakers. But she, after they had developed this program for the nurses, but then there was no way for them to have continuing education. And nursing, to get your license anyway, and I know in pharmacy and a lot of other areas, every time you renew, you have to have so many credits of current training in your field. And so that worked out quite well. But Effie was the one that it said, you've got to do this so that these nurses will continue to be updated and educated and pulled together, and they can share ideas and share experiences and problems, and that's how you work out a better program. And so that we were very thankful for her to do that. And once that my boss, Viv, met Effie, I was able to get a lot of money, and I brought her up to Alaska for my staff, but I also brought her for all the nurses in the state. So we advertised in advance so that nurses could get time off and be able to come in. And it was such a treat for them because they were so isolated working up in the bush area. So that worked out. So that was Effie. She's always on board. And she grew to really love coming to Alaska. She did start some of her programs in Homer, Soldotna area. A hospital went and did that. Let me see if I got everything in. Yeah, I think that's it. I think it's a program that still goes today, and we really, as a country, should be ashamed of ourselves. We have very low infant mortality rates. That is very poor. We're about in a third world country. And we really need to think about that and need to put money in that area. And in the prevention of pregnancies. And right now, the problem with this problem, it's not teenagers. We did solve the teenager problem. It's families.
Let's give her a hand. That was amazing, Kay.
It was amazing government program.
Well, I mean, the work you did to summarize that, I know you gave us a lot of information there and summarized it beautifully. Thank you. That really gave us quite a history to the nurse practitioner program and Dr. Chow, her contribution to that.
Oh, she did great. And what was I going to say? Oh, that Nixon, he worked personally with Planned Parenthood and with the Guttmacher Institute. Guttmacher Institute is a, what would you call that? It's a private concern that is very interested in reproductive health.
Well, I think that's a history that many of us were not aware of. Thank you very much. So, Charlene, can you tell us?